Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In this episode, we're going to be discussing the medication known as Diclofenac. Its brand name is Voltaren. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find the information to be valuable, please consider leaving a like on the video, as it would really help me with the YouTube algorithm. So first, what will we cover in this presentation? We'll start by talking about how Diclofenac works. We'll then discuss indications or reasons we would prescribe Diclofenac to a patient, followed by contraindications or reasons we would not be able to prescribe Diclofenac, then examples of dosing, and then stick around to the end where we'll talk about side effects. So how does Diclofenac work? Well, Diclofenac is an anti-inflammatory and analgesic agent, which means a pain medication. It inhibits prostaglandin synthesis through a mechanism that may involve inhibition of COX-1 and COX-2. Diclofenac also possesses antipyretic properties, meaning it can lower fever. In terms of indications or reasons we would prescribe this medication to a patient, we often see it used for mild to moderate acute pain. It can be used for moderate to severe pain with or without opioids. We see it used in rheumatoid arthritis as well as osteoarthritis. This medication can be used to treat ankylosing spondylitis as well as actinic keratosis. In terms of contraindications or reasons we would not be able to prescribe Diclofenac, we would not be able to give it to patients who have a hypersensitivity to Diclofenac or to any other component of the formulation. If a patient had an asthma, urticaria, or allergic type reaction after taking aspirin or other NSAIDs, non-steroidal anti-inflammatory drugs, in the past, they would not be able to use this medication. We can't use this medication for treatment of pain surrounding a CABG or coronary artery bypass graft surgery. And finally, it would be contraindicated in a patient who has mild or severe renal insufficiency and is at risk of volume depletion surrounding an operation. What about dosing with Diclofenac? So in rheumatoid arthritis, if they're using the delayed release formulation, we may see 150 to 200 milligrams per day orally in 2 to 4 divided doses. If somebody was using the extended release formulation in this setting, they may use 100 milligrams orally once daily, and they may increase to a max dose of 100 milligrams twice daily. If they were treating ankylosing spondylitis using the delayed release formulation, they may use 25 milligrams orally 4 times daily with an extra 25 milligram dose at bedtime if required. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Diclofenac, so I'll go over some of those here now. Some patients may experience indigestion, stomach pain, or nausea. Others may experience vomiting or diarrhea, potentially constipation. A headache would be a possibility with this medication, and some patients may experience increased blood pressure. Now, some more rare but serious side effects would be renal failure or kidney failure, hyperkalemia or an increase in potassium levels, or a gastrointestinal ulcer. That's all we're going to talk about today with Diclofenac or Voltaren. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.